Supportive Health and Human Services. I will turn it over to our County Administrator to begin the presentation.
Good afternoon, commissioners and residents of Franklin County. I'm Kenneth Wilson, County Administrator, and today you will hear of the story on how we are working every day to make Franklin County a place where every resident has the opportunity to live a healthy and productive life regardless of their background or circumstances. The 2025 recommended budget aligns with our strategic direction by investing in those areas that will allow us to advance toward our vision for this core principle. As seen in the presentations that follow, this budget and our agencies embrace the values of access, efficiency, and equity. We will begin today's session hearing from Deputy County Administrators Joy Bivens and Chris Long on the One Door Initiative and mobile offices that allow us to meet residents where they are. Michelle Lindenblum and Vivian Turner from Job and Family Services will discuss the service delivery challenges due to the demands for Medicaid and SNAP benefits. After that, we will hear from Patrick Gamble, our Early Learning Policy Administrator, and Bart Logan, Assistant Director of Communications at Job and Family Services, on the development of our early learning strategy before concluding with an overview of the agencies that fall primarily under this core principle of supportive health and human services.
Franklin County One Door is an initiative that unites the county's health and human service agencies to provide residents with access to multiple services in one location. It aims to support individuals and their families by improving well-being and economic mobility through a comprehensive and resident-centered approach. One Door was established to streamline the process for residents who need services from multiple agencies, reducing the need for multiple calls, meetings, and paperwork. This initiative unifies the Office on Aging, Child Support Enforcement Agency, Job and Family Services, and Justice Policy and Programs, making it easier for residents and staff. Bringing these agencies together has created opportunities for better communication and resource sharing. Efficiencies gained through One Door include a shared electronic needs assessment tool, a unified contract system, common goals and outcomes, coordinated public policies, and a centralized physical location where all agencies operate together. The One Door Initiative optimizes access to services, ensuring that individuals and families receive the necessary support to overcome challenges and achieve long-term financial stability. It reduces duplication of efforts, streamlines service delivery, and fosters a holistic approach to addressing residents in need. From 2022 to 2024, One Door has assessed agency operations, conducted research, and gathered feedback to shape its strategy. Work groups comprising agency staff have reviewed the best practices, recommended systems, and tools for a unified approach. These efforts have led to the development of a software system, triage tools, and improved customer service.
For ease of access by residents, an existing meeting room close to the county's main entrance on the lobby level of the Michael J. Dorian Building, 369 South High Street, was selected to be converted and renovated for use as a One Door location in the downtown complex. Public Facilities Management was responsible for managing the planning, design, and renovation phases of the One Door project in collaboration with the county's health and human services agencies. The new One Door location offers significant natural light that creates a welcoming and comfortable atmosphere, includes a curved teller station with 6 stations to assist residents, including 1 ADA station, and design features that support efficient queuing, provides workstations to be staffed by various agencies, and includes conference rooms and storage areas. Additionally, Public Facility Management's paint, carpentry, and security electronics teams completed various elements of the project. The Franklin County Data Center provided necessary cabling for network connectivity in the space. This priority project was completed in 2024 in about 5 months, with a total cost of approximately $196,000. Ease of access is also supported by our mobile offices, 2 RVs and 1 Sprinter van. Transportation can be a barrier for residents to access benefits and services. The RVs are 38-foot-long vehicles, which are maintained and supported by the 4 mobile office driver positions and other staff within fleet management, and provide the opportunity to bring services to the community and meet residents where they are located. In doing so, we can align all resources on the mobile units to help reduce transportation barriers and increase the agency's accessibility to residents across the county. Following the ribbon cutting in July, 44 events have been attended. It is expected that 3,000 residents will be served by the mobile unit within Job and Family Services Department of Strategic Initiatives. These services support the following goals in the Rise Together Blueprint. Goal number 8, improving maternal and child health among high disparity groups struggling financially. Goal number 10, improve overall environmental conditions in neighborhoods of concentrated poverty so that they are safe, walkable, and have easy access to basic resources, including access to nutritious foods. And goal number 12, increasing the number of children in safe and stable home environments. We are making great strides to provide seamless and accessible services to residents throughout the county. However, these advances are not without their challenges. Today, we are joined by the Department of Job and Family Services to share with us some of those challenges and how they are working every day to develop and implement solutions.
Franklin County Department of Job and Family Services touches the lives of more than a quarter of our residents. That includes over 9,300 residents receiving cash assistance through Ohio Works First, over 21,000 children receiving publicly funded childcare, more than 175,000 residents receiving food assistance through SNAP, and over 405 residents and families who have health care through Medicaid. For perspective, Franklin County's Medicaid caseload alone is larger than the population of all but 6 of the Buckeye State's 88 counties, and our SNAP caseload by itself eclipses the entire population of our neighboring counties, all but Delaware and Licking. JFS may be the largest agency under the Board of Commissioners, but for every 1 case manager on our staff, we have 1,000 residents who receive public assistance, and we get anywhere between 11,000 and 20,000 calls from them each week. Last week, it was north of 16,000. While we strive to ensure all residents are able to access our services, we understand that it can be a challenging and too often frustrating experience. Quite simply, our state phone system, County Shared Services, was not designed to handle volume of calls that large, diverse counties like ours receive. We know that some residents wait on hold for more than an hour to complete an interview, only for the system to drop their call shortly after they connect with an agent. We've got the logs that confirm it's the system disconnecting in most cases, not residents, and certainly not our staff hanging up. But we understand residents frankly don't care whose fault it is for dropped calls or long wait times. And they're right, it's unacceptable. And over the past year, we have put renewed focus on recruiting and retention to help address these challenges. Through September, we made 127 new hires and grew our staff from 556 to 631 full-time employees. That's more staff answering the phones, processing cases, and engaging with residents. And in April, we launched the first phase of our lobby reopening initiative, implementing changes in layout to link residents with the resources they need in a timely fashion. We also continue to push for enhancements to County Shared Services and worked with the state's vendor Deloitte to implement new features to improve the resident experience. In July, we became the first county in Ohio to play messages to direct residents waiting on hold for alternatives to apply for benefits or check on their case online. That same month, we became the first metro county to pilot the new automated outbound dialer for SNAP redetermination appointments. Since the launch, we have seen steady rise in the connection rate with residents from around 50% to nearly 60% last month. And we're saving time on the back end since we no longer have to manually create and assign daily call lists to staff. If the resident misses our call, the system leaves a voicemail and attempts to call back 2 additional times. These changes are making a difference. The Department of Administrative Services recently commended us for improving our call answer time from an average of over 61 minutes in October of 2023 to an average of 22 minutes in October of this year. And we are looking to build off this progress in 2025. That starts with staffing. And the recommended budget includes $2 million for the hiring of 20 case managers and 15 customer service assistants. Additionally, we are exploring bringing on a consultant with private sector call experience to help re-engineer our processes and improve efficiency. We also remain committed to meeting residents where they are, whether through the Board of Commissioners mobile units or by leveraging our 19 satellite locations across the county, from our major hospital systems and Columbus State to nonprofits serving our new American neighbors like Community Refugee Immigration Services and Bhutanese Community of Central Ohio. And at the same time, we're being asked by the state to do more. In October, the state effectively increased the income eligibility threshold for SNAP from 130% of the federal poverty level to 200%. While this is a welcome development to help reduce food insecurity for working families, there has been no additional funding provided to mitigate the increased workload. We've seen SNAP enrollment jump by 5,000 since October 1st, and forecast we could add as many as 40,000 newly eligible residents to our rolls over the next year. The additional staff in this budget will also address the impact of this new guidance. We've also had to make some difficult decisions, including allocating more of our temporary assistance for needy family dollars to offset the loss of federal emergency rental assistance dollars. While this is a necessary response to the needs of our community, the more TANF dollars we allocate for emergency assistance, the fewer funds that are available for our community contracts. Despite that, we will still be providing over $42.9 million in funding for a full array of cradle to career programming in 2025. That includes nearly $10.2 million to support a variety of early childhood initiatives and help advance the Board of Commissioners' long-term strategy for early learning in our community. As we strive to embody our county's motto, every resident, every day, we must prioritize those most vulnerable, our children. Children have no say in their start to life, and factors like their zip code shape their opportunities, dictating where they learn, their access to care, the relationships they build, and even how they play. Yet disparities in access to education and resources create profound inequities that follow them throughout their life. And over the past year, we have made remarkable progress in addressing these disparities, and a substantial portion of the early learning investments support Franklin County RISE initiative.
Franklin County RISE continues to serve as a cornerstone of our early learning strategy. As you know, this program was launched in 2022 with an initial $23 million investment of ARPA funds. This was a direct response to the pandemic strain on an already overburdened early learning system. This initiative places equity at its core, offering grants and incentives that increase childcare affordability and improve quality, all while adapting each year based on stakeholder feedback and outcome data. In 2024, Franklin County RISE continued its trajectory of success. We received national recognition, including a 2024 NACO Achievement Award, as well as being highlighted in the New Schools ARPA Equity Assessment for impactful investments. These accolades underscore our commitment to equity and innovation in early learning. RISE has awarded over 2,000 scholarships, with more than 650 this year alone. We administered over $3.26 million in incentives to 237 childcare programs to help navigate changes to Ohio's Step Up to Quality system, ensuring more providers achieve higher ratings under the new bronze, silver, and gold framework, and improve access for families. Additionally, our Emergency Rental Assistance Fund has helped stabilize 143 early learning teachers, reflecting Franklin County's commitment to a workforce that continues to be overworked and underpaid. Looking ahead, approximately $18 million in ARPA funds remain earmarked for RISE through 2026. For 2025, we're introducing a sliding scale to extend the reach of our scholarships, implementing an innovation fund for incentives for providers, and extending an additional incentive to our educators pursuing their Child Development Associate or CDA credential or associate's degree. We're also partnering with Idlewood and Company to conduct research with parents and providers, ensuring our strategies remain informed by diverse perspectives. As we move forward, our North Star remains clear: ensuring every child in Franklin County has the access to high-quality early learning experiences they need to thrive.
Our bold vision is taking shape with the planned Franklin County Early Learning Center. By transforming the decommissioned downtown jail site into a state-of-the-art childcare facility, we send a clear message: every child deserves the opportunity to thrive. This center will feature 28 classrooms serving over 400 children and integrating health, family support, and drop-in care services for families conducting business at the government complex. Leveraging county resources, we will provide nutritious meals, mental health services, and other supports that redefine how people view government's role in their lives. Earlier this year, we selected DLZ Construction and BBCO, a minority women-owned architecture firm, as our partners for this multi-year project. CK Construction Group Incorporated, a local firm, was also brought on this project for a construction manager at risk, partnering with 3C Industries, a local minority business enterprise construction management consulting firm. To ensure equity and opportunity, we've set a 20% small and emerging business enterprise aspirational goal for this project. Additionally, we'll be using LCP Tracker to monitor workforce development efforts, continuing our commitment to transparency and inclusivity, as we've seen in other recent county legacy projects. We've conducted listening sessions to articulate the county's goals for this project, and we're now in the advanced programming phase, where we're defining the facility's key components, including classrooms, administrative spaces, and public-facing services like our health clinic, the library, and a food pantry. While public facilities management will be the lead agency in managing this initiative, such projects involve significant collaboration with efforts from various county agencies, including the Purchasing Department, Prosecutor's Office, Office of Diversity, Equity, and Inclusion, and Office of Management and Budget. In 2025, we will lay the groundwork for the transformative project as we look forward to planning demolition for the vacant downtown jail, continuing the design process, and developing a project schedule and budget commencing construction, procurement, and outreach efforts. RISE and the Early Learning Center are integral to our broader strategy for addressing affordability, access, and equity in early learning. Ohio ranks last nationally for access to subsidized childcare, with initial eligibility capped at just 145% of the federal poverty level, far below the national average of 250%. These barriers disproportionately impact Black and Brown families, low-income households, and those children needing specialized care. Recognizing the childcare business model as fundamentally broken, Franklin County is taking the lead with a forward-looking approach. Early learning investments offer returns as high as $13 for every dollar spent and are vital to closing persistent achievement gaps. However, federal fixes remain uncertain, and state efforts often sacrifice quality for access. To address these challenges, we have convened a steering committee with representatives from more than half a dozen different county agencies, as well as our colleagues at the City of Columbus, to help define what our vision and our North Star is. We're looking at what other counties have done, both here in Ohio, like Cuyahoga, Hamilton, and Montgomery, and across the country, like Multnomah County, Oregon, Mecklenburg County, North Carolina, and Montgomery County, Maryland. Using data from recent countywide surveys, we've aimed to stabilize providers and create a vision where access to affordable and quality early learning is a birthright by 2050. Franklin County is leading the way in creating an equitable, sustainable early learning ecosystem. By investing in our youngest residents, we are not just addressing today's challenges, but laying the foundation for a stronger, more prosperous community.
There are 9 agencies that fall primarily within supportive health and human services, totaling $956 million or more than 40% of all the funds budgeted. Compared to the previous budget that was approved last December, these agencies will see a 3% increase. Just over 1/4 of the total is allocated to the 4 one-door agencies. Of the remaining 5 agencies, 3 are supported by property tax levies approved by the voters and 2 by the county's general fund. The 2025 recommended budget includes $254 million for the 4 one-door agencies, an increase of 7% from the prior year. The largest increase for the Office on Aging, which is attributed to the increase in board and care for residents enrolled in senior options, along with the timing of pay increases now that case managers have organized into a bargaining unit. Also seeing an increase is Child Support Enforcement Agency, resulting from a decreased vacancy credit to accommodate higher staffing levels, as well as increases in cost allocation expenses in contracted services such as those provided by the courts and law enforcement. On the other hand, Job and Family Services and the Office of Justice Policy and Program will see decreases. As mentioned earlier, the loss of federal emergency rental assistance dollars and reductions in other pandemic assistance have impacted the budget for Job and Family Services more than offsetting the additional frontline staff included in the 2025 recommended budget. While the decreases for the Office of Justice Policy and Program is primarily attributed to the timing of the grant receipts.
The 2025 recommended budget includes just under $702 million for the 5 other agencies that provide supportive health and human services. The largest of these agencies is the Franklin County Board of Developmental Disabilities, which will also see the largest increase. This is primarily driven by board and care expenses, as the agency is experiencing an increase in the complexity of services and in the number served overall, the loss of enhanced federal Medicaid match, and the rate increases for direct support professionals. Children's Services is expected to see an increase attributed to placement costs and additional investments in prevention services. While the number of kids in custody has decreased, the per diem placement costs have increased significantly. The 2025 recommended budget also provides $1 million for enhanced operational security, including the addition of 2 IT security analysts to protect the privacy of children and their families, increased scheduling for off-duty police and security personnel, the reconfiguration of existing office spaces, and the placement of trained clinicians to de-escalate potential mental health or behavioral issues when youth are on site. The budget for Veteran Service Commission is also higher than the prior year due to an increase in grant funding for immediate financial assistance for food and transportation. Based on current trends, it is estimated that 5,200 veterans will be provided food assistance from VSC in 2025, an increase of almost 11% over the number served in 2023. The recommended budget also includes the addition of 2 positions, a veterans benefit specialist and fiscal specialist, to meet the increase in demand. A decrease in expenditures is expected for the Alcohol, Drug, and Mental Health, or ADAMH Board. This is primarily related to the construction and furnishing of the Crisis Care Center. Each year, individuals in our community experience 30,000 crisis episodes. With a planned opening in 2025, the center will provide a complete crisis care continuum for adults that will offer a no wrong door philosophy to ensure that anyone who arrives at the facility receives or gets connected to services. A decrease is also expected for community partnerships, primarily attributed to a reduction in grants, as the support from the Coronavirus Local Fiscal Recovery Fund authorized by the American Rescue Plan Act winds down. This funding has been used to make various investments in the community, such as support to St. Vincent Family Center for renovations that house their children's residential treatment program, and Comp Drug that allowed for expansion of their outpatient treatment admissions and addition of a new partial hospitalization program at their location in the Milo Grogan community.
While the challenge of fighting poverty may seem daunting, I remind you to breathe, let go, and remind yourself that this very moment is the only one you know you have for sure. With these words from Oprah Winfrey and the Rise Together blueprint for reducing poverty to guide our decisions, I am confident we can reduce the degree to which someone's race, gender, religion, zip code, or parents' income determines their chance at the American dream. The 2025 recommended budget supports the creation of a streamlined model of wraparound services, direct outreach to meet residents where they are, and the modernization of county policies and practices. We will continue to be guided by our core principles and beliefs, ensuring all residents are able to reach county services, linking residents with the resources they need in a timely fashion, and counteracting disparities by enhancing services. This concludes today's presentation on supportive health and human services, and we will be glad to answer any questions of the board. Thank you.
Commissioner Boyce, do you have any questions or comments?
Yeah, thanks. Let me just thank the administration once again for your work in delving into the needs of Central Ohio, particularly our residents of the county. Administrator Wilson, I guess I'll direct this at you or one of the other DCAs. You mentioned a number of really important and to our residents budgets, particularly in JFS, aging, and some others, since that's the focus today, of increases. We've had conversations about the various levies that Central Ohioans have faced over the last several years and the projected levies that are looming. What are we doing to analyze the cost of living impact as we think about projecting even beyond the 2025 budget in our expenses? Are we embedded in this budget? Is there a study of the cost of living impact on the projected increases, or not just increases, but moreover the levies that have come into play? Those are increases, and other levies that are projected to be sought after. Have we started the process? Is that in the budget?
Thank you. Thank you for the question, President Boyce, Commissioner Crawley, Commissioner O'Grady. Yes, currently the Office of Management and Budget is doing their due diligence and looking to secure the services of a consultant to do a cost of living analysis. Because as you noted, one of the economic competitive advantages for Franklin County has been affordability and cost of living. But with the number of levies and other inflationary factors, if we're not careful, that competitive advantage could go away. Additionally, on the cost side, we are facing significant challenges regarding caring for our senior population at the level that we feel like is needed. So also we will be contracting with and working with a consultant to create the equivalent of a blueprint as it relates to prioritizing, determining the needs of our seniors in Franklin County.
Thank you for their response. And I think that's so important, even though a cost of living study would project out for our decision and planning, it's so important that we have that in mind as we make the choices and decisions in this year's budget. And so I think that's good. keeping in mind to the residents maybe watching, I mean, we're very mindful of the idea that many of these levies, while the resources are generally targeted at those who are in most need, the taxes also impact those who are most in need. And so sometimes it can be a double-edged sword. And so we want to be thoughtful about how we seek those levies, take them very seriously, and be sensitive to the other edge of the sword, which is not just the spending, but how it's collected, how the funds are collected. And so I'm grateful for that. If I could, and I don't want to hog up the time, no, Grady and Crawley are on as well, so I definitely don't want to be hogging up the time. So either of you just turn on your mics if you want to stop me and join in with your question. I completely don't mind, but if no one's asking, I do have some more questions.
Yeah, I have a question.
Who's that speaking?
Maria Madison.
Are you a member of the public, or are you a member of an agency?
Just the public.
Kid, how are you doing questions from the public? How are you doing that?
No. Maybe I heard you wrong. I got the email to go ahead. Someone else is speaking.
We're gonna allow for a public comment period or questions after the commissioners present any questions that they have.
So, ma'am, what he's saying is let me and my colleagues ask a few questions, and then we'll open it up for the public to ask questions. So just hang tight for a second, okay?
Yes, county administration has discussed it, and as it is our intention to allow for questions and public comments at the end of these hearings after the commissioners ask their questions.
Okay. Well, I got just a couple more. Then Ken, I think you and I are scheduled to meet, so I'll save some of them because they're a little deeper dive. On the question regarding JFS and the call center, and I'm kind of repeating the question because the public listening, I just want to help place where we are. We talked about the call center. I mean, I get lots of calls every year about people who can't get through and the hangups and different things. So I'm glad we have focused on that and are improving where we are. And I'm grateful for our staff and administration for doing that. But the technology today suggests that app-based programming, app-based resources are available or kind of the typical resource there. Are we looking into any of that technology to kind of extend, or are we still sort of bound to the state call system that we're in now?
Thank you for the question, Commissioner. Yes, we are attached to the state phone system. However, being the largest metro, we have a say, and so we have been very vocal in how things need to change. So they are looking into other things, and we're also looking into perhaps getting a consultant, but we have to go by what the state mandates. But we are offering suggestions for how it could be more streamlined for our residents, because the state phone system is designed for all 88 counties. So we are making tweaks to Franklin's queuing system and other technology solutions, but everything we do has to be approved by the state of Ohio and the Department of Administrative Services.
Okay. All right. Let me just let my colleagues. I got other questions, but I don't want to hog all the time. My colleagues may have some questions.
Yeah, I have a question. I'm pivoting. So if Commissioner Boyce, if your questions are still in line with what you were already asking, I can hold mine off.
No, ma'am. We can go back and forth. I don't want to hog all the time. So we just go back and forth. I'll just come back. So.
Okay. All right. Thank you. And so anyone who can answer this question from administration. I know you talked about the Adam H and their budget, and it decreased just a little bit, but I want to know, what are we doing holistically to address mental health and addiction countywide, outside of the crisis center, that's for acute care for people who are in crisis. I know the Family Stabilization Unit at one point in time was delving into mental health. I see our veterans budget is only increasing by $800,000. So talk to me about what resources are we going to be focusing on in 2025? Commissioner Boyce has a talk this week coming up on mental health. Mental health like we see through the pandemic and coming out, where people are really suffering and it's impacting quality of life, right? So talk to me about what are we doing? How are we going to address it in our budget process, in our agencies?
County Administrator, do you mind if I take the first stab at this one?
Yes, because we recently met on this, so yeah, take it.
Just,
DC.
okay, just recently, I'm gonna take it from this perspective, County Administrator, and then you can pick it up. Thank you, Commissioner Crawley. Thank you, Commissioners O'Grady and Commissioner Boyce. Commissioner, we have been meeting with Erica Clark-Jones at Adam H. And our goal right now is trying to establish how we operationalize mental health so that it is not an afterthought. So beyond referring residents and our staff to Credible Minds and some of our mental health supportive offerings that we have here at the county, we're working with them to create a package that we're calling Care Connections, where all staff will be trained in mental health first aid, as well as diversity, equity, inclusion, in addition to trauma-informed care. And we're going to not just train staff, but we're also going to have an opportunity to engage and receive some of the services if we deem it is necessary through those offerings as well. One of the things that we said we wanted to do was, as we are interfacing with the public, we wanted to be equipped when things arrive so that we can de-escalate, but notwithstanding, we understand that our staff goes through many of the same things the public goes through. So that's why we're going to start pushing more on Incredible Minds, which is the app, in addition to some of the offerings that our human resources agencies offers to the staff.
Okay. I just want us to be, and thank you for that update. I didn't know you all were working on that, but I want us to be just really intentional. Dealing with mental health and addiction can't just be one agency, right? It shows up in a lot of different places, impacts our residents who come through Job and Family Services, coming through Child Support, Office on Aging, especially for our aging residents, like the overdose and overdose deaths are increasing with our aging residents, right? And it looks different. Addiction and mental health looks different for our aging residents, where they find themselves maybe mixing prescription drugs with alcohol. So you see with our aging residents, those types of issues where overdose looks different than maybe someone younger. And I just really, to your point about it being an afterthought, I don't want it to be an afterthought. It is something that we have to aggressively address and be intentional, and especially with our Office on Aging. And I know that budget has increased a little bit. I don't want us to leave that just to one agency, because we see that happening.
Commissioner Crawley.
Yes.
I want to, Kenneth Wilson, County Administrator, Commissioner Crawley, President Boyce, Commissioner O'Grady. I want to expand upon this question and say that we also are looking at finding partners in the community that can help us deal with the mental health challenges of our male population. With coming out of the Soul Talks and coming in the Men's Summit that's coming up, we don't want to just identify the problems. We want to be able to have resources available and clinical professionals available to work with our men in the community, because there's stigmas and those things. As you know, mental health has been underemphasized, underutilized, particularly within the African American male community. So we're working in conversations with partners that are in this space. Additionally, as you know, adolescent behavioral health is a key issue that you all have continued to invest in through Nationwide Children's Hospital. their anti-suicide prevention programming, particularly targeting helping our youth, because there's so many factors that are causing depression and the bullying and all of those things in our community. So that's a partnership. And then lastly, and regarding the Office on Aging, we've had a number of contracts addressing issues like social isolation and bringing those other services together. So appreciate the question. It's definitely right up there at the top of our radar as county administration.
No, I appreciate that, because I was going to say, as much as we want and we're trying to help our residents age in place, isolation is a real thing. And so we need to be mindful of that. Also, the Bhutanese, Nepali, the Asian community, suicide rate is increasing as well. And so when we think about those who, where stigma is real, Black male suicide continues to increase. Our veterans suicide rate continues to increase. You have 22 veterans committing suicide every day nationally on average. And then when you think about the disparities or the racial disparities within that, Black suicide continues to increase. And so I just want us to be intentional about addressing mental health in all aspects, in all of our agencies, and with all population. And then one more question, and then I'll turn it to my colleagues and I'll hold off for my other questions, is housing. And I appreciate that, we are doing a cost of living study, and, we absolutely need to see how people are being impacted. We know that there are neighbors in our community who feel like we have a tale of two cities, where some are progressing and, moving forward, and others are feeling left behind. But we know that we have a housing crisis. And so where are we with, we address housing and affordable housing in a couple of different areas, whether it's through community partnerships or through general fund or through economic development and planning. And I know EDP wasn't on here today, so maybe it is next week or some other time we'll talk about EDP. But what is our plan to be intentional about addressing housing moving forward? I didn't really hear that in our Health and Human Services overview.
That is going to be covered under our conversation around economic development, jobs, and affordable housing. But I will touch upon it now, Commissioner Crawley, because it is of the utmost importance to us all. So this budget moves the affordable housing and emergency shelter funding under the county administration, and we're going to continue. We're going to identify affordable housing projects, and we're going to be very intentional about how we can increase the number of affordable units that we had initially set out to do going back to 2018. And also in this budget, we have funding available where we intend to work with a national consultant that has worked with organizations like the National Association of Counties, and we need a comprehensive housing plan for Franklin County. And that is something that we intend to do in this next calendar year. Also, we have a budgeted position that is meant to be dedicated to this work in carrying out and implementing a comprehensive strategy for housing here in Franklin County. But the housing issue is so complex that it is going to take a regional approach. All the entities within the county are going to have to be aligned in working towards finding solutions, because our issues around the number of unhoused and individuals in emergency shelter is a component of this, as well as the underproduction of housing in general within Franklin County.
Okay,
So-
I'll hold off since we'll cover this in another agency. I'll hold off my questions until then. So be prepared. Gonna drill down into this very specifically, but when we think about social determinants of health, again, this isn't just one strategy for one agency, right? Housing affects health. I would think that it would be outside of PRC or emergency rent and utility assistance. It would have been touched upon a little bit here, but I'll just hold off on housing until we have the agency overview.
Yeah.
Hey, Commissioner Crawley, can I build on something though? Can I jump in for a second?
Sure.
Thank you. Yeah, I just wanted to add, I'm really glad that Commissioner Crawley raised the issue of affordable housing, and Administrator Wilson, I'm glad that you gave the response you did. However, I think to Commissioner Crawley's point about the deeper dive and discussion, I really would like to have a deeper conversation, particularly with the commissioners involved, so that we can better align. I think Commissioner Crawley stated it well as a determinant of health, and really sort of engage in the deeper conversation, because quite frankly, one of the things I'm concerned about as we dig into this, and I hope you'll jot this down as well, is at the end of the day, counties don't control land use, generally speaking. We do outside of Columbus to an extent through Planning Commission, but that's going to limit the conversation around density, around area planning, and so forth. And so whatever we do in housing, we're going to have a very thoughtful, a very strategic, and a very creative discussion around what our best investment is. Additionally, housing is expensive. And I want to be thoughtful, again, to Commissioner Crawley's point. I want to be thoughtful about, in my earlier point, I want to be thoughtful about when we apply the costs to everybody, and that is, essentially the definition of regressive taxation. And I want to be, while I'm sensitive to the housing conversation, I think we haven't developed the model yet to find our place. NACO, I chaired the committee. NACO did a year-long study where we analyzed the role of the county nationally. And I think there is some data in that material that we should inform our direction with, because Franklin County was a county that was analyzed in terms of our authority, our financial capacity, and kind of how to apply housing. So I think I want to I'm really saying all that to agree spot on with Commissioner Crawley that it's a priority, but I just add that I think this is a very, very complex conversation, because it's also something that we are not ordained to provide. And so we don't have a deep history rather, of it. And that's why, the land bank was created. That's why, there are other partners that we invest with, like the name says my mind, but some of those agencies.
Affordable Housing Trust.
No, that's not what I was thinking. I was thinking of the one that Maud used to be with. Who was the one that Maud Hill was with?
Homeport.
Homeport, yeah.
Homeport.
Agencies like, there's other agencies like Homeport that we partner with, invest in, because that's the work they do. They focus on affordable housing, and they're able to manage properties with the economies of scale that is going to be difficult for the county to do. So, and they're nonprofits where they're set up to kind of just absorb and get to the basic cost. So I'm saying that to say, I think this is, I know you said there was a position in the budget, but I think that's somewhat cart before the horse, because we really haven't had the deeper dive discussion to kind of analyze where we want to go with this as the county. If it is our core, if we're going to make it a part of our core mission, and as Commissioner Crawley stated, it's part of our social terms of health that we are prioritizing. then okay. But I think we just haven't had that broader conversation to figure out how those funds play out and how the costs play out. And I think we need, in this budget conversation, a much more robust understanding of our financial position outside of 2025, so that we know what we're really talking about in terms of capacity.
Yes, because housing is, President Boyce, Commissioner Crawley, Commissioner O'Grady, housing is one of the planks of the Rise Together Poverty Blueprint, because it's so linked to the social determinants of health. And we know that you got to look at housing in a very holistic way. Also, we will be looking at in the hearings before we're done, the county's commitment to housing for individuals that are displaced due to involvement with the criminal justice system, which is a huge issue for us here in Franklin County. But through our Office of Justice Policy and Programs, that's a component of housing as well. And the home program, which most people are aware of, that's a community development block grant HUD funded. That's another component of the housing, in the housing space. But we realize that it is not just one size fit all. You make a key point, Commissioner Boyce, is the zoning and land use. With density not being properly applied, it makes it that much harder for home builders to find places to create the mass that's necessary if the capital and investment is there. But we can't do this without our nonprofit partners, as you noted. That's really the place where the county can be strategic and help incentivize projects through the LIHTC program, for example, which is a lot of the projects that we are able to participate in. But we're not, before we close this year out, we have some contracts and hope to get some more affordable units approved and out the door.
Yeah, I just begin to Commissioner Crawley's point. I think we need an opportunity to take the deeper dive. I know we've got to get through this budget cycle. And am I on mute? Oh no, I know we got to get through this budget cycle. And so I won't belabor that, but I agree wholeheartedly with her that it really deserves a conversation in itself. And even in the budget and what's in there, I'm a little skeptical of the dedicated position, but we can talk about that. I'm open to kind of where we're headed for this year.
Okay.
Sorry, Commissioner Crawley. You made such a good point. I want to jump in there. I don't want to lose that. I'll go ahead. Refer back to you.
The housing conversation is, we could spend the rest of this afternoon's session on the housing conversation alone.
Right.
I'm reluctant to jump in and expand the conversation simply because there are too many points to be made, and it would take up the rest of the time if each time each of you made a point, I wanted to jump in, and I thought I'm not going to do that because I'm going to expand the conversation beyond probably where our budget director, Mr. Telerik, wants us to go. We probably could have and should have an internal conversation simply on housing, because we didn't even discuss new housing starts, which is a whole other piece of the conversation. And we didn't discuss the mayor's plan for the regional conversations that he's been having as well. There's a lot more here. I want to just go backwards then and talk about a whole other topic that we haven't discussed yet. And I just want to quickly bring up one little thing, and then we can move on. and it has nothing to do with housing. So I wanted to bring up the mobile units if I could. Very pleased about the mobile units. One, I wanted to know how many do we have and what is the strategic plan for the disbursement, the implementation, the disbursement, or the use of the mobile units, because it's great that we have them, but if we don't have a plan for getting them out into the community and using them, then they are just a nice, expensive, beautiful tool. We got to get them out there, and we've got to have a plan, a strategic plan for their use. So if somebody, I mean, Joy, I'm sure that you can do it, but if Michelle or Vivian or Bart needs to jump in as well, that'd be great. So if somebody can tell me what the strategic plan is, I'd love to hear it.
So in 2025, I'm going to jump in. I think this is going to be.
How many do we have? How many do we have?
We have 2 large mobile units and we have 1 sprinter.
Yeah. That's what I thought. That's what I thought.
Yeah.
Okay, go ahead.
So in 2025, we are going to deploy a concept that we are coining case managing neighborhoods, where we leverage data down to the zip code to understand what is the greatest need in that zip code, so we can be very intentional about addressing systemic barriers. So if we go into a zip code and it is identified that that zip code has tremendous food insecurity, we know that we need to beef up on those professionals who can address that systemic need in addition to workforce. So when you ask, what is the plan? Those mobile units, Commissioner, if I am not mistaken, they are out pretty regularly right now. We have standing appointments at our shelters. We have standing appointments at our far south side, where, as you know, there is a food desert in addition to transportation barriers based on that zip code, and that's one of our highest impoverished zip codes. So we can get you the calendar, how often they are out, but please know that the plan for 2025 is to be intentional about case managing neighborhoods, utilizing data to ensure that we deploy what is the highest need into that zip code. And then when we identify families who need to be followed in those zip codes based on numbers and traffic, that will establish how often we are going out. We are also partnering with a partnership with Columbus Metropolitan Housing Authority, as well as the NAACP, that they have coined Level Up, where we are going out into their living communities for those folks who have vouchers, where we're going to be having standing appointments there as well. And I believe that was launched last week.
That's good. I get text messages from folks with photos when people see them out in the neighborhood, so I know they're out there. I just wanted to know what the strategic plan was for it.
And we will make sure you get the report, Commissioner, because when we're going out, there's a monthly report that we're keeping track of how many folks we service, what was the highest need that was addressed, and those types of things. Again, it's aggregate data, but we do have a report that that's established on a monthly basis. Am I right, Chief Turner and Director Linda Boom and Bart? Yep.
Great. Mostly it's just people messing with me, telling me they see my ugly mug out there on the street, but it's good to know that they're out there, but I'm glad to know there's a strategic plan for it, because
they're overbooked. They have a lot of events.
They're fantastic. I love the plan.
For what it's worth, Commissioner Grady, I've only heard people say positive things about your face.
Well, they all tell me how pretty you are, Commissioner. Well, I love the conversation on housing. Would love to continue it further. Maybe I know we suggested an administrative session on the Community Shelter Board. Maybe we can consider an administrative session on housing as well at some point. Would love to have a larger conversation on housing because we had just a few minutes here this afternoon, and but I just felt I would have loved to continue it. I just felt like we were hijacking Zach's budget hearing. I would have been if not you guys weren't, but I would have been had I jumped in. So
You all are totally able to hijack anything you want to related to the passage of this budget. So I got time, commissioners. I got time. This housing conversation is so critical, and we have a lot of work to be done, and that's very
Well,
true because
as-
we have to move on from the magnet fund and determine, what the new policy is that we look at going forward on those type of projects. So we have a lot of work to be done. On the 26th, we will have we'll be prepared for a robust discussion.
Well,
Uh,
as Commissioner Boyce said, when he did all the work that he did with with his NACO colleagues on the studies that they did nationally. When I was the chair of the large urban county caucus, housing was a major conversation that we all had with the largest counties in the country. And as I continue to say, both with our colleagues across the state and across the country, affordable housing is a problem that we all have, whether we're large counties or small counties, red counties or blue counties. Affordable housing is not a problem, in any one place, in any region of the country. It's not a Republican problem or a Democratic problem. It is all of our problem. And, we're struggling with it here in Franklin County, but everybody's struggling with it. And it's, our Republican colleagues across the country bring it up all the time in little counties. And this is a big deal. And so, I know that, it seems like it's just our issue, but if the folks in Washington don't get their arms around it, and the folks at the State House don't get their arms around it, how are we expected to get our arms around it? And so,
Such a great point.
we are working on it day in and day out here. It's been frustrating. I know that we talk about it all the time. We're going to continue to talk about it. We're going to continue to work on it. But we are, we're not in this alone. But we're all working on it, and we're going to keep working on it. The mayor's out there talking to our colleagues. I gave the mayor cell phone numbers for our Republican colleagues in our surrounding counties. He's been on the phone with them. He's going out and sitting down and having breakfast and lunch with them and talking to them all. I hear back from them that he's out there talking to them. Basically talking to them about getting those surrounding counties involved from a funding standpoint, because they need to be able to come to the table as well. And he's been getting a good response. They've been giving me a good response, letting me know that they're all in as well. So hopefully we can all join hands, stack hands, and try to get something done here.
Commissioner Brady, Administrator Wilson, Commissioner Crowley, I just want to add a couple of things. This is such a timely and deep conversation. And I have heard the mayor's presentation, by the way. I was with him at the partnership retreat, and he talked about it. But I also just want to, and there's food for thought, because I really just think that we haven't come up with the sort of right strategy nationally yet, because you think about Franklin County alone, our property taxes, which directly impact the cost of housing in Central Ohio, went up anywhere from 30 to 60% in some places in the last valuation cycle. We've had a variety of levies that have lost count, quite honestly, and including a sales tax increase. And so all of those have direct implications on the cost of housing. And I'm only saying that to say that I think we haven't figured out what the answer is yet. This is going back to my work as the chair of the Housing Commission for the NACO. I feel like it hasn't existed out there, because new taxes, more taxes are not the answer, because the same people that we're trying to help provide housing to end up paying the cost, and that doesn't make it more affordable. And so Ken, Administrator Wilson, one of the things I want us to be thoughtful about is the strategic use of our money towards housing. We're all in agreement that it's a core value and something that we need to do, but is what we are able to do and how we're able to do it, and I just want to throw in supporting the housing reduction costs, and we learned this from our work in the commission, come from infrastructure investment, come from supportive services, the things that we are supposed to provide to our residents. Those all directly can reduce cost. And so I want us to be really, really thoughtful and really strategic. And when we say, let's go build some, I think that's not the answer because of the cost. And so we have to think about that at a partnership level with the private sector, with other government entities. So I think the conversation will come together. Everybody seems to understand the complexity, but I'm not going to let up on this cost of living piece because I think it's serious. When you at the retreat, one of the things they identified was they did a regional review and did an index of all of the comparison places to Columbus around the country. And Columbus was probably number one in cost of living, but it also showed that it was eroding very fast. And if we lose that, we're going to lose that something unique and special about Central Ohio that I think is going to cost us. So anyways, I throw it out there because I think Crawley and O'Grady and Wilson, I think we're all in DCA Bivens, everybody's keen on it, but it really deserves that deeper huddle. I like the administrative session thought suggestion by Commissioner O'Grady, by the way.
And so, Commissioner Boyce, just to support what you and Commissioner O'Grady are discussing, when we pull together the entire team of folks who administer or process those emergency housing applications, we had a convening with all of them. I simply asked them a very simple question. Why are so many people applying? What are you seeing? And what their response was, people do not make enough to substantiate the cost of living. So they're looking at the applications from the perspective of what's coming in, what's coming out, and what is sustainable. And from their, purview, they're saying the cost of living and folks not being able to afford. Second thing really quick is, as we're going into 2025, trying to deploy this concept of case managing neighborhoods, there's this correlation of aligning systems where you look at a housing unit and you look at how many affordable early learning centers, quality early learning centers are in that neighborhood, how many clinics, what are the nonprofits that are involved. So we're trying to figure out how do we develop this schematic to support where folks are actually living so that there's no burden and there's easy access to those supportive services that they need. It is a work in project right now. It's a concept, but we are going to try to tease that through in 2025.
Well, we got smart people, smart commissioners and other elected. So I think Central Ohio can lead the way. So it's a good discussion.
Thanks, commissioners. I know we do have one other presentation on the core principle of.
Hey, Zach, I wasn't done.
Oh, I'm sorry.
Yeah. This is a quick question, I think. You mentioned that Adam H. was decreasing their expenditures, and you said it was primarily related to the construction of the new facility, the crisis care center. How is that center going to open, but their budget's going to decrease? I presume there'll be new budgetary requirements there, but that's not the case. Is the expectation that it's going to streamline services and that's going to reduce the costs? And so how's that work?
No, they do have some cost, Commissioner, on that, but the amount of one-time construction costs that occurred in 2024 more than offset that increase in terms of the operating costs for the crisis care center.
Okay, so I get it. Okay, I think that should be okay. All right. Then there's one more. Okay, you answered it, I think, when you were answering, somebody answered it. I wrote a note down. Okay, thank you. Sorry about that.
I apologize for cutting you off, Commissioner.
No, no worries, no worries. No, it's all right.
Budget Director, Telerik, our clerk's office, I think if we have, individuals that would like to make a comment or public testimony, let's try to, take care of that right now before we go to, community safety and security and effective justice.
Thank you, Administrator. This is Michael Ruhrman, Deputy Clerk to the Board of Commissioners. At this time, anyone online who wishes to make a public comment on this hearing, go ahead and raise your hand in the Zoom chat, and then we'll review the rules for public comment before proceeding. You'll be asked to unmute your phones or devices, and then we'll have a comment period. Seeing and hearing none, I'll go ahead and turn things back over to Director Telerik.
Thank you. So that will conclude today's presentation on the core principle of supportive health and human services. We will next hear the presentation on the core principle of community safety, security, and effective justice. However, we will need a couple of minutes to get everything set up. So we can have maybe 2 or 3 minutes, and then we can begin that presentation.